The Inland Empire Health Plan and Healthy Heart Nation have partnered for this series to discuss the importance of heart health in the African American community. Leading this conversation is Kenita Bourne, a licensed clinical social worker and the manager of social and community services at IEHP, and Dr. Columbus Batiste, a board-certified interventional cardiologist. Let's join this conversation where we will dive deep into crucial topics and provide you actionable tips to help you and your loved ones live heart-healthy lives.
Okay, so now obviously I am well-versed on understanding what high blood pressure is, or pressure, period.
Yes.
So now here's my question for you.
Okay.
Should I be checking my blood pressure regularly? And if so, like, at what age do you start doing that? Like, give me all the information.
Yeah. Well, first I'm gonna go back to something that I may have repeated in our prior conversations. You have to inspect what you expect.
Okay.
So part of inspecting what you expect is that you have to check it, just like you're gonna check your bank account, just like you're gonna check your social media accounts, your Instagram and all the other stuff like that. You have to check your blood pressure. Knowing your numbers is so important.
Okay.
And the easiest way is not just doing it once a year. We don't check those things once a year. We check it every day. You should check your blood pressure on a regular basis so you know what the numbers are, just like you're stepping on the scale, just like you're doing certain things, right?
So I should be checking my blood pressure every day.
If you have high blood pressure, it's a good thing to know what your numbers are. Absolutely.
Okay.
Same time of the day is ideal for checking your blood pressure.
So, but what if I don't know if I have high blood pressure or not? Like, is there kind of a barometer to say, if you're this age, if you look this way, if you feel this way, you should start checking your blood pressure regularly?
Yeah, so we want to know about your blood pressure as early as possible. So when you go into your doctor's visits, because you should be seeing your doctor at least once or twice a year, right? And so if you go in to see your doctor and you've been identified as having high blood pressure, what is high blood pressure? It's definitely a blood pressure top number, systolic, 140 or above, bottom number, 90 or above, right? So if you identify that, then the next step is, okay, let's begin to check our blood pressure at home and use what's called a self-measured blood pressure check. That means it becomes very easy. There's a lot of validated tools out there that you simply just slip it on. You go ahead and you cuff it up, get the cuff that's the appropriate size. Size, it matters, right? Size matters, I'm gonna tell you.
Doc,
That's
you
what
did
I'm
not
told.
just say that.
It's true, size
Well, you know
matters.
what?
Because guess what happens? Now, I don't know, Kenita, come on, let's bring it back. Let's bring it back.
We're here.
Bring it back.
Okay, the
Right,
cuff.
So we're talking about blood pressure cuff here, right? So if on these big ginormic arms, if I put a small blood pressure cuff on, my numbers are going to be falsely high.
That
If
makes
I
sense.
put too large of a cuff on, my numbers are going to be falsely low. So you want the right size for your arm. And so the great part is manufacturers have done a great job. You can simply measure it. They actually have a little marker that you can see. If you're using the right size cuff, you put it on and then you measure it and that's it. And so one of the key things is also you want to make sure that you're nice and comfortable. So just like you have your legs crossed, don't do that.
Don't cross my legs. Okay,
Yeah.
uncross my
You want
legs.
to have your legs uncrossed. You want to have your arm at the heart level. So have a nice table or armrest that you can rest it. And see how my heart's here? Right hand over the heart, right? Pledge of allegiance.
To the
same sort of
flag.
thing.
Okay.
And so you're having it right here. And now you have the blood pressure there at that same level. You measure it and you see what the numbers are.
Okay.
After you relax. Now here's the thing. If the numbers are high, a simple tool, and we'll talk about this even more, just take a few moments to relax. Take some deep breaths, relax, wait a minute or so, and recheck those numbers.
Okay.
And so as you begin to do this, if you were to have symptoms or if you had concerns, you're going to check this blood pressure every day. And you might check it once or twice a day, depending upon if you're concerned about certain symptoms that you're having.
Got it. So how much is too much in a day to check your blood pressure?
Depends on you. So
Okay.
I've told some patients I need them to back away, right? Because they get a little too nervous. So the stress, because one of the main things that we find when patients come into the hospital or to doctor's clinic visits is that they develop something called white coat syndrome.
Oh, yes.
Right? You know what that is?
I do.
Yeah, so you go in and all of a sudden your blood pressure's sky high and you're like, Doc, I swear my blood pressure is not high. Well, how are you gonna know it's not high unless you're checking it at home? If you're checking it at home frequently, you understand the baseline of where your numbers are. Now, I'll tell you, there still is a risk of having white coat syndrome. And the reason why is you're under a level of stress in that moment. And that stress tells us how your body's responding. That's why the blood pressure is elevated. So that means that we still need to look into tools in which we can address your response to stressful states,
Nice.
that we can decrease your burden of disease going forward.
Decrease your burden of
Come on now.
disease.
That's
I
right.
love that. You just preached the word.
I've been doing this for a second. Come on.
Okay, I guess you are the professional. But that was going to be my question too, because there's a lot of people who do have white coat syndrome.
Yes.
Every single time they go into the doctor's office, they have a high blood pressure. So what I'm hearing you say is individuals who have white coat syndrome, they should, regardless of age or anything else, they should be doing regular blood pressure checks at home.
Absolutely.
Okay.
I think it's important to know what those numbers are.
Nice.
So you know if this is a one-time event or if this is something that is more recurrent. The blood pressure is not static. It's not like a brick wall. It goes up, it goes down, it can fluctuate throughout the day. It can fluctuate according to situations. And so it becomes important to know what your numbers are and how you respond to it for all of us.
Got it.
All right.
Thank you, Doc.
Absolutely.